Thanks for coming to this virtual press conference again. We are now about 2 weeks into phase 2 of opening. However, the number of new cases in the community has increased from an average of 4 cases per day in the week before to an average of 8 cases per day in the past week. We have also a number of unlinked cases in the community, averaging about 4 per day in the past week. This is not unexpected as more activities resume and the number of interactions increases. A similar trend can be observed in many other countries that have exited from lockdowns and lifted restrictions. Amongst the community cases in the past 2 weeks, the majority were picked up from our active surveillance and screening. On the whole, the incidence rate for the community cases remained low. Nevertheless, the multi-ministry task force is closely monitoring the numbers. We want to detect cases early so that we can ring-fence them and prevent large clusters from forming. Let me give you an example. On 23rd June, we detected a case who works at the Leo dormitory as a result of our proactive screening of individuals who work at dormitories. We initiated contact tracing and found 6 other cases over time within the same family cluster at 111 Tampines Street 11. On 27 June, another case emerged that immediately caught our contact tracers' attention. This case reported no interaction with the previous family cluster, but they live in the same block on a different level. So it immediately caught the attention of our contact tracers and our antennas were up. Our contact tracers decided to investigate further and flag it out for closer monitoring. Even as epidemiological investigations are ongoing, we decided to take additional precautionary measures beyond the usual measures that have already been activated upon the detection of these cases, including quarantine and so on. We decided to proactively identify all the 58 households residing in the same section of the block that is served by a common lift lobby and stairwell, given the possibility that there may be inadvertent contacts between the households. We contacted them to check if they are well. 2 of them were unwell and were tested. The results were negative. Everyone in the identified units is then put on active phone surveillance. In addition, the affected common areas in the block has been disinfected and regular cleaning up has been stepped up. As these households are not really close contacts of the confirmed cases, they are assessed to have a lower risk of being infected. But we want to be a little bit more careful because asymptomatic transmission could occur. Therefore, we offered COVID-19 testing for all of them. Thus far, MOH has contacted 160 individuals among these 58 households, including visitors. 58 individuals were swabbed yesterday and all have tested negative. 29 more individuals are expected to be tested over these 2 days, and we'll provide an update and the results when they are ready. I thank the affected residents for their cooperation and patience, especially those who have come forward for the testing. Should there be further infected cases, we may have to put in further precautionary measures. The task force will continue to press on with our efforts in early detection, ring fencing, and aggressive testing. But the role of the individual is arguably even more critical. I urge everyone to continue to remain vigilant and be socially responsible so as to protect ourselves and our loved ones. If we work together, each one of us playing our role, we can keep the number of new cases limited and minimize the risk of large clusters from being formed. So on this note, I would like to invite my Director of Medical Services, Professor Mark, to give an update on the medical situation today.
Thank you very much, Minister. As of the 2nd of July 2020, 12 noon, the Ministry of Health had preliminarily confirmed an additional 188 cases of COVID-19 infection in Singapore. The vast majority still comprise work permit holders who reside in foreign worker dormitories. Based on our investigation so far today, there are 10 cases in the community, of whom 8 are either Singapore citizens or permanent residents, and 2 are work pass holders. In addition, we have seen one imported case that was detected through testing while being placed on a stay-home notice after arrival in Singapore. We will provide further details of the cases and further updates in our usual press statement that would be issued later tonight. Minister has shared about our intention to aggressively pick up community cases through this period of time now that we have moved into phase 2. This includes active case finding through regular routine testing of various identified groups that have frequent contact with vulnerable people and who work in essential services. We've also extended our suspect case definition for the purposes of testing at our primary care clinics and polyclinics, and this now extends to testing all people who present to a GP with acute respiratory symptoms above the age of 13. And these are ways in which we continue to look aggressively for cases that may be present in our community. Large majority of these cases have mild or no symptoms at all, and indeed as we test, we find that a number of these cases that we report each day, in fact, have signs through their test results that suggest infection may have occurred quite some time ago rather than fresh infections. We do not wish to let down our guard, and we continue to be vigilant looking for more community cases. We ask the community to cooperate with us and to maintain their personal discipline in hand hygiene, the safe distancing measures, and the use of masks. It is very important that they continue to do this, particularly at this time when there's a lot more services, a lot more people moving out into the community, and a lot more mixing of people occurring in the community when people are visiting others in their households. And we ask, therefore, that you keep yourself safe, your family safe, your close friends safe, and others around you safe, because you may be infected, asymptomatic, and it's important that we safeguard that risk and prevent that risk of further transmission. Thank you very much.
Good evening. So you've heard the sort of assessment of the current situation today. Overall, it is stable, it is under control, but we are indeed seeing an increase in the number of cases, including the number of unlinked cases, which we had expected and which we continue to monitor very closely. Some of these cases that we've picked up arise from the active testing regime that we have put in place to periodically test certain segments of workers, particularly those in the higher risk groups. But some of these are also people who have come forward to the doctor, particularly with symptoms. They present themselves to the doctor, and then when we test them, we found that they are indeed symptomatic and they have the virus. For many of these cases, when we test them, nowadays we also do a serology test. And as the Director of Medical Services said just now, a number of these cases test positive on serology, which means that they are older infections. But we are also seeing a few that test negative on serology, which means that they are more recent infections. So the number of cases are rising. There are cryptic infections, if you will, taking place out in the community. This has, continues to happen from back even before the circuit breaker and all the way through till today. The difference is that during the period of the circuit breaker, people were largely staying at home. They had very few contacts with other people. And so even if one were to have the virus, it really doesn't spread very far. It ends up being a dead-end transmission because, you're staying at home, you have very few contacts, at most 1 or 2 persons in the family, and then it stops there. But today, if someone has the infection and the person doesn't see a doctor quickly, goes out to work, to dine out in a F&B outlet, then the risk of transmission increases to other people. The risk of transmitting it to other people goes up, and there is that risk of larger clusters forming. And that's why as we have highlighted, we now move in a lot more aggressively, a lot faster to identify all the possible close contacts. And we try and put a large sort of a ring fence around that confirmed case, right? Just like we have described just now, we heard from Minister Gan, the situation in the Tampines block. We go in, we know that there is a case, we immediately go in to identify a larger group that potentially might be close contacts, and we quickly test them and isolate any potential infected persons. So that's the new way of operating in this phase. Because of our increased capabilities in testing and tracing, Singaporeans and residents here should expect that potentially more people will be notified whenever there is a case. More people may be asked to go for testing. More people may be quarantined because we are casting a wider net around every single infected case in order to more effectively ring-fence and isolate the virus and stop it from spreading to other people. While we do all that, and while we have this enhanced testing and tracing capability, I think we should not take it for granted that this system is foolproof and we can catch every single case. We should not push the system to its limits. We should not be taking unnecessary risk. So while we have indeed enhanced our system of testing and tracing, while we are doing it as aggressively as we can, it again requires everyone to do our part, to take all the necessary precautions, to stay vigilant and uphold all the social distancing measures. That's something all of us must do in order to ensure that we can continue with this progressive approach of resuming our activities safely. So we again call on everyone to cooperate, stay disciplined throughout this period so that we can ensure a safe reopening for Singapore. Thank you.
I would like to invite questions from the media.
Members of the media, please remember to use the raise hand function if you would like to ask a question. Please only ask one question to allow more to participate in the Q&A. May we have the first question from Cheryl from CNA.
Hi, good evening. I would just like to ask about the record dengue numbers and how, are we testing perhaps both dengue and COVID, given some of the symptoms may be similar? Thank you.
Let me just clarify this. We are focusing on COVID-19, but I see that there's some relevance to dengue because you wanted to know, do we co-test them? I think with regard to between dengue and COVID-19, I think the approach to testing is quite different. For the testing of COVID-19, we have quite an established strategy and framework for testing and a clear case definition of how we test them. And today we test all ARI's symptoms and in order to allow us to detect these cases much earlier. Whereas dengue, the case definition is also quite clear, quite defined. And sometimes when both symptoms exist, we do test both dengue as well as COVID-19, depending on the presentation of the cases. Maybe I'll ask the DMS to elaborate more. As you know, I'm not a doctor, so I'll ask the professionals to give the professional assessment of the two different infections.
Thank you very much, Cheryl, for that question. Indeed, our doctors are on their alerts and lookout for dengue. We already know that we are having a dengue outbreak amidst the COVID outbreak we have, and that complicates matters for our doctors because they have to distinguish between a fever that presents in a patient with COVID-19 infection versus a fever from dengue. And indeed, in many of these patients where it is not possible clinically to make that distinction on the basis of clinical symptoms and signs, the patients will be tested for both dengue and COVID to make sure that they are not missing one or the other infection. We are aware also that there are some cases where one might have a false positive test when we test for dengue, and therefore our doctors are also vigilant to that possibility, and they want to make sure that they don't miss any possible COVID-19 infection arising in a patient who's got fever. That said, we haven't seen the outbreak waning just yet as far as dengue is concerned. We are still comfortable as far as our capacity in our hospitals because many patients with dengue are not in fact needing to be admitted into the hospital. They are typically, many of them are typically seen in our primary care clinics. They may have blood investigations that need to be done, but many of them do not need to be admitted. So from that perspective, the dengue outbreak at this point in time has not taxed us in terms of our ability to provide hospital care for patients, whether COVID-19 conditions or other medical conditions.
I should add that although dengue is not part of the press conference today, it is important to remind all Singaporeans to keep, to eliminate all possible breeding sites for mosquitoes. Because with that rising number of dengue cases, it does eventually stretch our medical system and also raises the number of cases that our clinics have to see, and therefore it also creates more noise in terms of detection. So it will help to keep the dengue number as low as possible. I know we are entering into a peak period, all the more important for us to ensure that we eliminate dengue mosquito breeding sites. And also remember that nowadays from the COVID-19 perspective, we encourage people to work from home, and therefore there is also higher opportunity for mosquito bites at home, and therefore all the more important for us to eliminate breeding sites where possible. So I urge Singaporeans to help us, to collaborate with us to minimize the breeding opportunities for mosquitoes. This way we will keep the dengue number down and help the management of COVID-19 as well. Thank you.
Thank you, Minister Gan and DMS. May we have the next question from Salma from the Straits Times? Salma, please hang on. Salma, your question, please.
Can you hear me?
Yes.
Right. Is swabbing for COVID-19 optional? I'm referring to the Tampines group. You mentioned there were 160 people in 58 households, but then only about half have come forward for swabbing. So if it's not compulsory and they're only under house surveillance, active house surveillance, I know they're not close contacts, but if one person could have gotten it from somebody else in the block, they all pose a risk. So if it's an optional thing, they may be asymptomatic, would they then go on to pass the virus on to others?
Yes, let me address that question. We'll ask DMS to add on. I think first, as you pointed out, these are not really close contacts, and there's some risk of exposure because you don't really know whether they have interaction. We have interviewed them, and they generally do not have interaction with the infected families. But we want to be extra precautious, take extra precaution, and that is why we offer them COVID-19 testing. And so far, we have a significant number of them stepping forward. We have tested them. They have all turned out negative, and there will be some more of them coming forward over the next 2 days. And beyond that, we continue to engage them and to encourage them to come forward to be tested. But because they are really not in a high-risk group, we do not yet want to impose a mandatory testing on them. However, if we do find additional cases among these voluntary testing, we may decide to take further measures. And what the further measures will be will depend on the nature of the cases that we detect, whether they are in the same household, whether there are specific features, whether they are actually quite random, and it may become necessary. And when that time comes, we'll make an assessment whether we will impose a mandatory testing for the rest of those that are living in the same section of the block, or even if we detect other cases, we may need to extend the testing to the whole block. So this will depend on the situation as it develops over the next couple of weeks. So we continue to monitor them. And because of the number of cases that we are testing today within this block, it would already be quite useful as an indication, as a surveillance of the underlying cases that may be transmitting within the block. So I think the initial test will give us a sense of whether there is likely to be a real problem or not. And then having done those tests, then we'll make an assessment whether is it necessary for us to extend these tests further. Maybe DMS will add on.
Yes, I hesitate to say cluster, but really the number of cases that we have in the block in Tampines reflects a much more aggressive approach we're taking now towards contact tracing, ring fencing, isolating, and also making every attempt to disrupt any potential and possible chain of transmission may arise from the cases that we see in our community. And this is in part driven by the fact that now that we have come out of phase 1 and circuit breaker into phase 2, we are determined to do our best to pick up as far as possible every community case and to prevent further onward transmission of infection to others in the community so that we do not need to see us progressing back into restrictions as we had in circuit breaker or phase 1. The other household units that we've identified for surveillance have no demonstrable link to the cases that we've seen in the two flats in this particular block. However, because we want to be extra cautious, we've taken the opportunity to identify the common core stairs and lift that potentially may give rise to mixing as people move out from their flats into community and back. And then, on abundance of caution, we've put all the residents in these household units that are likely to use this lift and stairwell on phone surveillance, really to make sure then that if there are any potential cases that come out for any reason due to some form of transmission may occur in that community household setting, we want to be able to detect that early and then control that. So it's really on the basis of that caution that we have embarked on this campaign of additional phone surveillance. We added on the additional step of inviting those who are interested then to come forward and to have testing done. This is not only to give us an opportunity then to detect asymptomatic but infected cases that are present, but also to provide an assurance to residents in the community that in fact if they are coming forward, they test themselves and find themselves negative, then they can also have an assurance that they are not potentially infected or exposed at this point in time. We continue to put those who have declined our offer for testing under phone surveillance, and we continue to contact them on a daily basis during this time to make sure that they remain healthy and well. But of course, if any of the residents who initially declined our offer to come forward for testing then change their mind, we would then invite them to come down and be tested as well. So the offer is never over, even though we had reached out to them already on one day. And at any time during this period of time, they change their mind, they want to come forward, we will welcome them to come and get tested as well. And this is part of our commitment to make sure that we are on top of things and we are going to be able to detect aggressively any early signs of infection, cluster brewing in this particular block.
I should perhaps clarify that we are not saying that the two household cases are linked. We have not established that link yet, but because they stay in the same block, in the same section of the block, we wanted to be extra careful, and therefore we take this additional step by offering them additional testing to make sure that we also have a sense of surveillance to see whether there are underlying cases or not. And we are not likely to do this for every case that we detect, to offer testing for the whole section or any block that we find a case. We do this particularly because one of the household has 7 cases and the other household has 2 cases, altogether 9 cases. At the same time, they live in the same section of the block, and therefore we wanted to be extra careful. Beyond that, we have to be quite clear that we have not established that the two households are linked clusters. So we are still treating them as two separate clusters, and we are continuing with our investigation.
Thank you, Minister and DMS. May we have the next question from Zhi Peng from Zhao Bao?
Hi, good evening, Ministers and Prof. Mark. So just to clarify, just to follow up on your previous reply, so those who are placed on additional phone surveillance, they are not placed on SHN? And also, I understand that the vulnerable seniors have already received their first batch of Trace Together tokens since last Sunday. My question is, will more people be given this Trace Together token, and when will they receive it? Thank you.
That's correct. For those residents that we are placing on phone surveillance, they are not actually on any quarantine order or stay-home notice. But of course, if they are on phone surveillance, we encourage them to keep their movements to the minimum so as to mitigate any potential risk that if they eventually are found to be infected, they will not be exposing too many other people due to close contacts that they have. So they're not on phone, they're not on quarantine orders, they're not on a formal SHN notice, and our invitation for them to come forward for testing remains on a voluntary basis. You asked the second question in relation to the TT or Trace Together token. The first batch, as you know, were distributed out to vulnerable seniors. And as more of these devices are made available, we will continue then to distribute this out to those who are particularly at higher priority. They will continue to be prioritized towards our vulnerable seniors and then to other groups as well. It's really a matter of making sure that we have as many of the tokens available, and once we have them, we will distribute them accordingly.
Thank you, DMS. We will have the next question from Stefania from Financial Times.
Hi, good afternoon. I was wondering if you could give us a bit of an update in terms of border controls. Firstly, in terms of the Singapore-Malaysia Green Lane, is there an update in terms of when that could materialize, and if there are any updates vis-a-vis the statement that was put out by the Foreign Affairs Ministry recently? And in addition to that, if the discussions with other countries in terms of setting up these green lanes bilaterally, if those have moved ahead, and who these countries are and who they're likelier to be.
Well, all the discussions that we've highlighted, whether it's with Malaysia or with other countries that we have listed before, are ongoing. So the officials are discussing with their counterparts. We have a model for the green lane or fast lane with China already set up. I imagine that similar arrangements will be put in place with all these other countries that we are discussing. None have been finalized as of now, but like I have said, as and when any of these are ready, we will highlight, we will explain, we will announce, and then the green lane with these countries can start. The other aspect of border controls refers to our measures for the stay-home notice that we require for all incoming travelers. And we, some time back, adjusted some of these measures for a group of countries, which we allowed for the stay-home notice to be served at home rather than in dedicated facilities. So again, that's something that's dynamic because we are constantly reviewing the situation, the infection situation around the world and in different countries. And as and when we see changes and as the situation gets updated, we might also adjust some of these measures. And again, we will announce them when we are ready.
Thank you, Minister Wong. We will have the next question from Niveda from NHK.
Hi, Ministers and Professor. I would like to ask about if there's any updates on the latest numbers for the number of foreign workers who have been cleared from the virus. I know that there was a press release on 30th June which said that 87,000 workers are cleared, but I was wondering if there's any new updates on that, and that before Minister Lawrence Wong had said that 120,000 have been cleared in total? Yeah, if there's any updates, that'd be great. Thank you.
Sure. The last update we gave was not too long ago, where we said about 120,000 have been cleared, meaning to say they are either recovered workers or they have been tested to be free from the virus. Amongst that 120,000, about 80,000 have already started work. The remainder have not started work yet, and that's even though they are able to, the workers are able to, but there are a range of reasons why they may not be immediately able to resume work. It could be because the companies have not put in place the appropriate measures, because it's not just about the workers, the companies also have to meet the requirements. And it may be that the companies are unable to do so for accommodation, for transport, a whole range of possibilities. So as and when these companies are able to meet the requirements, then these remaining workers will also be able to resume work. That hasn't changed very much. I mean, the numbers would have increased by a few thousand because every week we are clearing more and more, every day we are clearing more workers, but it's largely similar because that was the situation just last week, I believe. By end of July, I've said that around 70 to 80% of the workers will be tested and cleared, and either recovered or tested and to be free from the virus. Based on the latest situation, as we project ahead in the coming weeks, the rate of clearance, the rate of testing, we believe we can get up to 80% of workers by the end of July, maybe even higher. So we are on track for that rate of clearance, but exactly when the workers can go back to work, again, as I mentioned, depends on the company's readiness as well, not just the workers' individual status. So even as we proceed to test and clear the individual workers, we are also in parallel now engaging all the employers to encourage them to start taking steps to get ready for their workers to recover or to be tested free from virus so that they can immediately start work once the workers are cleared. Otherwise, if they were to do it sequentially, right, they wait for the workers to be cleared, then they start putting in all the procedures and processes and applications, then again, it incurs another few weeks of delay. So rather than wait, we are encouraging all the employers, contractors, companies to start making preparations now in parallel so that when the workers are cleared, immediately they can resume work. So hopefully by August, right, early August, we can see the vast majority, if not all, the migrant workers in the dormitories back at work safely.
Thank you, Minister. We will have the next question from Shahida from Berita Harian.
Hello, Ministers. Good evening. I just want to ask, with the campaign in full swing, I just want to get a general sense by the task force whether safe distancing and other safety guidelines are being adhered to, especially by the candidates when they do their walkabouts by the various political parties.
Right. Well, the elections department is very mindful of this. As we have highlighted before, the task force sets out the overall framework, the requirements that would apply nationwide in phase 2, and then the elections department, based on these national guidelines, will put in place the rules and regulations and the requirements for safe elections and for safe campaigning. So they have complied, or the elections department, based on the national guidelines, have put out a set of very strict requirements for all political parties, for all the candidates, as well as the activists and volunteers and helpers involved in the campaign. And on top of that, the elections department, government officials are going around as safe distancing ambassadors, and enforcement officers are out and about as well. So I'm quite sure the elections department will, not only have guidelines, but also have people on the ground to ensure that the elections are conducted in a safe manner for everyone.
Thank you, Minister. The next question will be from Kai from Channel 8 News.
Hi, just now you said that some of the patients, they go to GP and they are symptomatic, and many of them go through the serology test and found out that some of them are tested positive. So that means it's older case. So what does that mean to us? Is it like there's a worrying trend that people are delayed in seeking treatment, and any complications? Will this pose a challenge in our contact tracing work?
Thank you very much for that question. I'd like to perhaps clarify this. At this point in time, the mainstay for testing still remains PCR testing, which we use for making a diagnosis of COVID-19 infection. Our primary care clinics, whether they are part of the PHPC network or polyclinics, would use the criteria that we have put out and disseminated to them for suspect cases, as well as the criteria for active case finding and extended surveillance for patients coming with acute respiratory infections. And they will use these criteria as a basis for testing, making a decision to test their patients. That test is a PCR test. The test results are reported to us, and we look at each individual positive case that then is reported to us. We have to make an assessment in terms of where they could possibly have got an infection from, as well as when we think that infection had taken place. And it's in that setting, then we look at other features. We look, in fact, at what we call the CT value in PCR tests, and sometimes looking at that value, it can give us some subtle clues as to whether or not this is likely to be a recent infection versus a much older infection. And we follow through in a number of these patients with other tests, including serology tests, to determine whether or not they have antibodies, and the presence of antibodies would suggest that some time has passed already between the onset of their infection and the time in which they were tested. The tests that we do, serology tests, may also extend then to their close contacts, because we want to also make sure that these close contacts were not previously infected, perhaps asymptomatically, and rather than the first case that we see being the source of infection, it could very well have been someone else spreading the infection to that particular person. So as we investigate and look at close contacts, we sometimes will also test these individuals as they go into quarantine, as they come out from quarantine, and in selected instances, we may also do serology tests as part of our epidemiological investigations to assess when that infection had taken place. As we had previously said in several press conferences, we had highlighted previously some cases where we believe that their infection, the exposure to COVID-19 virus, did not occur immediately during the time when we moved out from phase 2. It could in fact have occurred long before they had even moved out into COVID, the circuit breaker period of time. So that's important for us as well, because we would want to know whether or not we need to cast the net wider. But effectively, in many of these patients who presented to us with a positive test, and we think those infections were quite some time ago, they were almost all asymptomatic, and therefore they were very well, their close contacts was well, and therefore this did not in fact cause any problems for themselves or their households.
But I think the point to remind everyone, which is I think what the question was alluding to, is the importance of going to see a doctor immediately when you feel sick and when you have flu-like symptoms, rather than to assume that it's a very mild sniffle, it's something that, seems okay, and then I can just go about my daily activities as per normal. This may not have been so bad during the circuit breaker, because if you feel like that and you are just at home, you have no contacts, the risk of spreading to many people is very low. You're just at home, and everyone is at home, staying put, and very minimal contacts. But if people were to have that kind of mindset, it's a sniffle, I self-medicate, I avoid seeing a doctor as far as I can. Even when I start to feel feverish or I start to feel like I have a flu-like symptom, I take Panadol and I hope that it will be okay. And worse, on top of that, I go about my daily activities and meet many people. That is when the risk presents itself, because in phase 2, individuals are out and about a lot more, and we are in contact with more people. So we really need to remind everyone, if you feel sick, if you have flu-like symptoms, stay at home, and then better yet, go and see a doctor immediately. And if the doctor diagnoses you with ARI, they will ask you to be tested, and it's better that you get tested and verified that you are free from COVID-19 than to pretend that you don't have the virus or not know about it, and then potentially you could infect others around you, including your family members. And if you have elderly people in the same household, I think the consequences of infecting someone senior in the home can be lethal and can be dangerous.
Thank you, Minister and DMS. We have time for the last 3 questions. Can we have the next question from Lynette from the Business Times?
Hi, good evening. Lynette here. My question is, given this current update in terms of the rise in cases and unlinked cases, does that mean that we are going to see a further increase in the number of cases linked or unlinked? And what does this mean for the timeline towards phase 3? Thanks.
I have to say that the increases in the linked and unlinked cases that we are seeing in recent days is not unexpected, because, as I mentioned several times before, that with the opening of phase 1 and now we are in the midst of phase 2, we do expect the number of cases to go up. The key is to quickly ring-fence them, detect them, ring-fence them, prevent further spread, and most importantly, prevent the emergence of multiple clusters everywhere. Then we have a potential problem in our hands. So therefore, we are still continuing to monitor the situation, and so far, I think the overall number of cases in the community is still low, but we should never be complacent, and we should not let our guards down. That's why I was using Tampines as an example to show how we want to be aggressive in detecting cases, in testing people in a very targeted way, very effective way to detect cases as early as possible so that we can try to ring-fence them. So I think this is a strategy that we would adopt going forward to make sure that even as we open up, we are careful, we do it carefully, and we do it in a way that will not create major clusters and large spikes of number of cases. So these numbers, we are continuing to watch them. The numbers that we are seeing is not unexpected, and I would say that even in the coming weeks, we do expect to see the numbers to continue to go up somewhat, because I think the number that we are seeing these few days, part of it may be the result of phase 1 and not a full effect of phase 2 yet. Remembering that phase 2 was just about barely 2 weeks ago, and with the incubation period of 2 weeks, and on top of that, some may have delayed reporting, and some after detection, it will take time to be diagnosed, detected, and until the day we report, there may be some gaps in between while we verify the details, and therefore it has not fully reflected the effect of the opening in phase 2. We need to continue to monitor, and you may see the number of cases continue to climb somewhat, but what is important is to keep an eye on the total number and spikes in the number, as well as clusters that are being formed. That's why when we saw the Tampines Street 11 cluster, we were particularly concerned, and that the number is 7 in one household, but in a way, because it's in one household, it's more contained. Had it been the multiple clusters in multiple blocks within Tampines, then we will become very, very concerned. So I think it's something that we want to watch, and we want to be proactive and aggressive in screening and detection and ring-fencing them. So that's how we will continue our strategy going forward as we open up in phase 2. And I think so far we will continue to look at how we can confidently and safely continue our opening process, and eventually we'll reach phase 3. So we are still in the monitoring stage, and the time will come when we may announce additional relaxation, but I think it's too early for us to discuss at this point. We ought to focus on monitoring them and trying to catch every case that pop up and see whether we can control it, ring-fence it, to prevent further spread. And if we can do so, I think there'll be an opportunity for us to make further progress in opening within phase 2, and eventually we'll reach a phase 3.
Thank you, Minister Gan. We will take the next question from Tessa from Today.
Hi, Ministers. My question is kind of a follow-up from the previous question. So is there an assessment of whether we are more likely to move forward to phase 3, or at the moment it seems like we are more likely to introduce more restrictions because of the trend of more cases coming up?
I thought I more or less answered that question. I think at the moment, we have not shifted our strategy in our phase 2 and our progress towards phase 3, but we are watching the development of the situation very carefully, because the number of cases are rising as expected. If it rise much faster, or when we see large clusters popping up, we may need to tighten some measures. And I also explained in previous conference that even if we tighten measures, it is likely to be more targeted, depending on the nature of the transmission, the background of the cases. It may be in certain settings, it may be in regard to certain activities, and if it involves a certain activity, we may decide to tighten and introduce additional precautions for these activities. If it is a specific setting, we may decide, okay, maybe we will need to ring-fence that setting, reduce the number of people being involved, or increase the social distancing, safe distancing within these settings to prevent further spread. So it will depend on the nature of the cases that will pop up from time to time, and we'll decide what measures may be necessary in a targeted way based on the nature of these cases that emerge.
Just to add very quickly, we said before that phase 2 would continue for months before we are likely to enter phase 3, which would be effectively the new steady state until a vaccine is found for the virus. So that assessment remains. And what does months mean? It's really hard to pinpoint at this stage, because we are just really 2 weeks into phase 2. It's still early days. At this stage, even within phase 2 itself, we have certain rules which we have highlighted, potentially over time can be relaxed. But we are not moving to any of such relaxation anytime soon. We have the current rules, they remain, group of 5 people. We have not allowed bars, pubs to reopen. I don't think it's not going to happen anytime soon, because we still need to monitor the current situation before we can get to further opening of more premises. We have not allowed large events, MICE, conventions of this nature to happen. And again, we are unlikely to allow any of such events, large sporting events, concerts. These sorts of things are unlikely to happen anytime soon as well. So that remains, that was an assessment earlier, it remains the same assessment today. We continue to monitor the situation. It may get, we do expect the number of cases to go up, as Minister Gan has highlighted, because we are testing more aggressively, because we are casting a wider net and we are doing more active case finding. The key to understand is, firstly, our mode of operations has changed, right? We are going in faster, casting a wider net, we are notifying more people, and so on the ground, potentially more people will be notified each time there is an infected case, more people will be isolated, quarantined even, and more people will be tested. So that's the change that is happening. The Tampines is an illustration of this new model. We are fortunate that in Tampines, when we did that test, so far, we have not detected or picked up any additional cases beyond the 2 households. It could have very well been a very different situation where we do a sweep and we find many more households infected. Then it might even have necessitated a bigger shutdown of a wider area around those few blocks. Right? So this is the way we would operate, right? Going in aggressively, testing, identifying, putting putting in place perhaps not generic restrictions, not general restrictions, but specific restrictions at the work sites, potentially at business premises, or at the places of where people reside. And we go in, we cast a wider net, and we will put in these localized restrictions to contain the virus. And we likely will operate in this manner for quite a while before we get to phase 3.